Hell no, we cannot do lipo of the arm. Okay, so no, not again. Arm lipo here? No. Not gonna need this for her arms because she's not a good candidate for arm lipo. Okay, yes, this is perfect. This is an arm I can do liposuction on.
Behind the mask, the more you know, the better you look. Behind the mask, the more you know, the better you look. Behind the mask.
Okay, yes, these are arms that I can do liposuction on. She's a very good candidate for arm liposuction. Why? First of all, she's got good quality skin here. So I'm not worried about her skin, you know, being too wavy and loose and making her arm look worse after lipo. So the first thing that has to happen is the skin has to be of good quality. So she's got good quality skin. The second thing we need is we have to have fat. But remember, we need more than fat. We need to have fat that is giving her a shape that's not as attractive as if that fat wasn't there. So sometimes you can have fat in your arm, but you have a normal shape to your arm, so you're not a candidate for lipo. But in this situation, she has fat that's here, and she's got good quality skin, so both of those criteria are met. And this fat here is giving her a change in her shape that's not as attractive. So those things make her a good candidate for arm lipo. In the arms, we actually want this line to be more straight. So we really want this line in the arm to be more straight. And so we see this line has this kind of hammock shape to it. And we really want this line to be much flatter here. So that's what the shape change is for arm lipo, is that we're not talking about any OG shape. We're talking really trying to get more of a straight line. So sort of an unusual. And that will change from this hammock, and this fat will leave, and so it'll look like once the skin will re-drape. Remember, the skin has to re-drape around the arm, and her skin quality is good, so we know it'll re-drape. And so then what'll happen is we're gonna get that line, and that'll just make the whole arm look thinner. Now, I'm just gonna have you straighten your arm. I usually don't do a lot of lipo over the deltoid muscle. This is a shoulder muscle. So what I usually do is come down here and I'll lipo all this up here. And everyone has like a different gradient. And so her gradient runs this way, meaning there's more fat as we're moving from her elbow. You can see here she's got a small amount of fat. But as we move up her arm, it gets more and more and more and more and more. And so sometimes I see people and they'll have like an even amount of fat, sort of even from top to bottom. Sometimes patients will have this gradient here completely reversed. So they'll actually have more fat here and less as we go up the arm. And so they have that kind of bulge right here that hangs over the elbow. Because this is another point here, another adhesion point. Just like, we talked about points of adhesion here on the back. This also is a point of adhesion. And so this can be stuck in here, and you can have a big fat deposit draping over the elbow. But in her case, she's got the gradient going this way, so there's less fat here, more fat as we go up the arm. So I'm going to perform more heavy liposuction in this area, and then lipo throughout the whole back of this arm here. And so the skin will contract and she'll just get a much flatter arm. And because she's got so much fat up here in this part, we really can't see the heads of her tricep muscles. But once we remove this, in wait probably about 6 or 8 months, we'll see the heads of her tricep muscle. Why is she not a good candidate for arm lipo? Because her arms look great. So you'll see that her shape is totally normal. Even when we look down here, I'm right on her bone, okay? And then I'm gonna have you just flex right now. Just flex, okay, so perfect. No te mueves. So you look here, and now you can actually even see some of her tricep in here. And this is, there's no fat. She's got a little bit of fat, but that's normal, just relax. She has a little bit of fat, That's normal, but her shape is good. This is just a totally normal shape. And so if I liposuction here, we could get divots and we could get irregularities and changes in the shape that are not helpful. They're going to make her arm look worse. So we don't want to do that. So no arm liposuction for her. So she does have some fat in her arm, but her shape is really good. And with some weight loss, she can remove some of these fat and get a thinner arm. But I don't think she's a good candidate for liposuction because the shape is good. So when you liposuction, you know, people always think that you're going to just maintain the same shape, but they get everything smaller, but the shape will change. So if she's got a normal shape to her arm, that's a no-go for me for lipo. The other reason that I think, you know, I would prevent me from doing arm lipo is I tend not to do arm lipo with a tummy tuck, and I tend not to do arm lipo with breasts, because with both of those operations, you really need your arms in order to help you move, in order to recover. And so if I do a tummy tuck, she has to get up and down out of her recliner, off the wedges, the bed, everything. She's going to need her arms. So I definitely don't do arm lipo when I do a tummy tuck. I'll do other lipo when I do a tummy tuck, but I won't do arms. And then the same thing with breasts. You get a lot of changes in sensation to your chest, and you need your arms to help get your bra on or off. And if I do arm lipo at the same time of doing breasts, I kind of take your arms away in terms of the recovery, and you just have a harder time. So when I do arm lipo, I prefer not to do it when I'm doing a tummy or I'm doing breast, but I will do arm lipo if I'm doing a BBL, or if we're just doing full body lipo, then I can include the arms too.